I'm Dr. Lauren Hyman, and welcome to Scooch Down, where you can talk to your gynecologist like you talk to your friends. So you've been trying to get pregnant. It's been a year. Seems like everyone you know is pregnant, but you're not pregnant yet. What does a basic infertility workup consist of? Well, what we want to find out is if there is any reason why you haven't conceived yet. The vast majority of time, basic infertility workups show nothing wrong with the woman and nothing wrong with the man. But you want to rule these things out so that you can go on, and if there is some type of a situation, fix it. So what are we looking for with a basic infertility workup? We want to make sure the woman is ovulating, we want to make sure the man is making healthy sperm, and we want to make sure there's no reason they're not getting together. Let's start with the woman first. For the woman, it's mostly blood tests. On day 3 of the cycle, we want to do a blood test to look at hormones. We want to look at the estrogen, the menopause or FSH hormone. Sometimes we'll look at an anti-Müllerian hormone that can help us look a little bit more closely at the quality of the eggs left in a woman's ovary. We want to look at the thyroid, prolactin level. Sometimes we'll even look at the glucose and the insulin levels. All these things are things that can affect metabolism, affect hormones, and cause the woman to not be ovulating regularly. Let's look at the man. Just as often, it's the man's side that determines why a woman is not getting pregnant. It's a simple semen analysis. We like the semen analysis to be collected 3 to 5 days after the last ejaculate so we can get a really good specimen. We want it to be delivered to the lab as quickly as possible. And what does the lab look for? The lab makes sure that the sperm are healthy, that there's a head and a tail, the number of sperm, the motility, and that they're moving forward and how fast they're moving. Once we know that the sperm are good, once we know that the woman's ovulating, are the sperm and egg getting together? There's a procedure called a hysterosalpingogram that can help us determine that. HSG, hysterosalpingogram. Essentially, it's a tubal dye study. A small catheter is inserted into the woman's cervix and dye is pushed up, filling the cervix, the uterus, and out the tubes. Then an x-ray is taken. We can see if there's any blockage in the tubes, if there's any defect in the uterus, possibly both tubes are blocked, and that's why the woman's not getting pregnant. There's another test called a postcoital test. You know that egg white discharge people get mid-cycle? Well, that is to help trap the sperm and make it more likely that that sperm is going to get up there and meet that egg. With a postcoital test, the woman and man are asked to have sex and then come into the office afterwards. The doctor with a pipette takes a little bit of the cervical mucus out of the cervix, puts it onto a slide, makes sure it is nice and long. That's called spinbarkite, and there's good stretch. And then with that slide, looks under the microscope to make sure that the sperm are active, healthy, and swimming around after having come into contact with the woman's cervical mucus. It's a test for the cervical mucus and to make sure there's nothing going on between the man and the woman once things are coming together. So once we've made sure that the woman is ovulating, the man's sperm is healthy, and there's no reason that the two of them shouldn't be meeting, we can go on to next steps as far as helping the woman conceive. This has been a discussion about a basic infertility workup. Thanks for tuning in to Scooch Down. I'm Dr. Lauren Hyman. I'll see you next time.